When you have a positive pregnancy test, the most important thing that your obstetrician wants to figure out is what is your due date. Typically, we ask you what your last menstrual period is, and then we figure it out from that. But some women have irregular cycles or they can't remember when their last period was. Don't worry about that because a first trimester ultrasound early in pregnancy gives us really incredibly important information. When we as human beings are inside our mother's uterus and we're less than 10 weeks along, we're all about the same size. We're just little tiny fetuses growing inside our mother's bodies. And we can take measurements and we know if a pregnancy is 6 weeks along or 7 weeks along or 8 weeks along. And those numbers are very accurate. We measure what's called a crown rump length. Now, if we measure a baby that's almost due, the baby can weigh 6 pounds or the baby can weigh 10 pounds. So just like when you go to high school, your friend could be 5 feet tall or your friend could be 6'6", human beings are all different sizes. But early in pregnancy, we're all about the same exact size. So that first trimester ultrasound, when we're not sure of the last menstrual period, is so important to determine the due date. Your due date, your gestational age, is the information that obstetricians use with your every single visit that you have. So make sure that when you miss your period and you have a positive pregnancy test, go to your doctor and be evaluated. We want to figure out your due date as soon as we can. And guess what? Once we figure out your due date, it will never change. We may be wrong. Only 1 out of 20 women actually deliver on their due date. But regardless of when God decides that your baby's going to come, we're going to know whether it's too early or if it's just right.